Hello and welcome everyone to Knowledge Park. Today, we are exploring one of the most fascinating organs in our body, the adrenal glands. These small but mighty glands help us handle stress, maintain energy, and stay healthy. Whether you are a medical student or simply curious, this video will give you a complete understanding of adrenal glands. The adrenal glands, or suprarenal glands, are small, triangular-shaped glands located on top of both kidneys. Despite their small size, each weighing just 4 to 5 grams, they perform crucial functions that affect your entire body. The adrenal glands are your body's built-in stress response system through the HPA axis. They help you manage everything from daily challenges to emergencies by mobilizing energy within seconds. Understanding them is key to understanding your health. Let us start with the basics, then go deeper into anatomy, function, disorders, and care. By the end, you will have a clear, practical roadmap for adrenal health. Now let us look inside an adrenal gland and see how its parts work together. Each adrenal has two main parts, the outer adrenal cortex and the inner adrenal medulla. Think of them as two factories in one small building, each producing different products. The adrenal cortex makes up about 80 to 90% of the gland. Zona glomerulosa produces mineralocorticoids, mainly aldosterone, regulating blood pressure and electrolytes. Zona fasciculata produces glucocorticoids, mainly cortisol for stress response, metabolism, and inflammation control. Zona reticularis produces adrenal androgens, including DHEA, precursors to sex hormones. Each zone has specialized enzymes that determine which hormones are produced. All adrenal steroids are synthesized from cholesterol through steroidogenesis. Specific enzymes in each zone direct pathways toward mineralocorticoids, glucocorticoids, or androgens. Aldosterone secretion is tightly linked to the Renin-Angiotensin-Aldosterone System for volume and pressure control. The adrenal medulla functions differently, with chromaffin cells producing catecholamines. Epinephrine and norepinephrine drive the fight-or-flight response within seconds. They increase heart rate, blood pressure, and energy availability immediately during stress. Cortisol follows a circadian rhythm, peaking around 8 a.m. and reaching its lowest point near midnight. Regular sleep patterns support this rhythm and overall adrenal health. Feedback at the hypothalamus and pituitary keeps cortisol within healthy ranges. Glucocorticoids impact metabolism, immunity, bone, and brain. Mineralocorticoids regulate sodium and potassium. Acute versus chronic stress produces different hormonal patterns with different clinical implications. Now that we understand normal function, let us see what happens when things go wrong. Adrenal disorders generally involve too little or too much hormone production. Adrenal disorders fall into two categories: too little hormone production or too much. First, Addison's disease, or primary adrenal insufficiency. In Addisons, the adrenal cortex is damaged and cannot produce enough hormones, often due to autoimmune attack. Symptoms develop gradually and include persistent fatigue, muscle weakness, and weight loss with decreased appetite. Low blood pressure with dizziness, salt cravings, and gastrointestinal symptoms like nausea or diarrhea can occur. Darkening of skin in certain areas is characteristic. In severe cases, an adrenal crisis can cause life-threatening hypertension, low blood sugar, and severe weakness. On the opposite end, Cushing Syndrome involves excessive cortisol production. It can result from adrenal tumors, pituitary tumors producing too much ACTH, or long-term corticosteroid use. Characteristic symptoms include weight gain in the face, between the shoulders, and the abdomen. Purple stretch marks, thinning arms and legs, and muscle weakness are common. There may be facial hair growth in women, high blood pressure, elevated blood sugar, and easy bruising. Hyperaldosteronism, or Con syndrome, is overproduction of aldosterone causing hypertension and low potassium. Pheochromocytoma causes excessive catecholamine release with episodic high blood pressure, headaches, and sweating. Adrenal cancers are rare malignant tumors that may secrete hormones or cause mass effect symptoms. Recognizing patterns of too little versus too much hormone guides testing and treatment. Next, let us see how clinicians confirm these conditions and choose appropriate therapies. Diagnosis involves blood and urine tests to measure hormone levels. ACTH stimulation tests assess adrenal response. Dexamethasone suppression tests evaluate cortisol regulation. CT or MRI visualize adrenal anatomy and detect tumors or hyperplasia. Adrenal vein sampling helps localize hormone overproduction, especially in hyperaldosteronism. Addison's disease requires lifelong glucocorticoid and mineralocorticoid replacement. Cushing syndrome may need surgery, radiation, or medications to control cortisol. Pheochromocytoma is treated surgically after preparation. Adrenal cancers typically require surgery and adjunct therapies. A balanced diet provides the building blocks your adrenal glands need to function properly. Vitamin C from bell peppers, citrus, broccoli, and berries supports cortisol production. B vitamins fuel energy. Magnesium supports cellular energy and stress resilience. Healthy fats aid hormone production. Quality protein stabilizes blood sugar. Eat breakfast within an hour of waking, have regular meals, and keep dinner lighter by early evening. Avoid refined sugars, excessive caffeine, highly processed foods, and trans fats. Protect your circadian rhythm with consistent sleep patterns. Diaphragmatic, 4 to 7, 8, and box breathing activate relaxation. Focus on moderate activity and yoga. Avoid excessive high intensity when stressed or fatigued. Recent advancements include a deeper understanding of genetic factors that contribute to adrenal disorders, helping doctors personalize care. Improved imaging technologies, such as high-resolution MRI, now enable earlier and more accurate diagnosis of adrenal conditions. Newer medications are designed to be more targeted, offering effective treatment with fewer side effects. Research into adrenal tissue regeneration and stem cell therapies continues to show great promise for restoring gland function. One of the most exciting breakthroughs is the development of implantable, bioprinted adrenal tissue. Scientists are exploring how 3D bioprinting technology could one day provide a functional cure for adrenal insufficiency by creating personalized adrenal implants. To recap, adrenal glands are vital for stress response, metabolism, and electrolyte balance. The cortex produces steroid hormones, while the medulla makes catecholamines. Common disorders include Addison's disease, Cushing Syndrome, and Pheochromocytoma. Diagnosis relies on hormone tests and advanced imaging. Treatment is guided by endocrinologists. Nutrition, exercise, and stress management play supportive roles. If you have symptoms or concerns about adrenal gland disorders, consult an endocrinologist for expert care. Thank you for being with us. If you found this video informative, please like and subscribe.